Start with trust when it comes to technology and seeing providers in a remote setting. That is something that comes up in all age groups. Is am I and that's why you'll even hear me. I try not to ever say virtual care or a virtual nurse, right? Because it's real care and it's a real nurse. So to me, how we break down the question of how do we engage trust is education and explanation. So in our emergency department ED triage model, every hospital is different, but I think the best operation is to pair up the nurse that's in person along with the starting of any kind of remote care. So if a patient comes in, we'll use behavioral health too, right? There's always problems with trust there. Patient comes in seeking care, and we're going to have to get them in touch with a remote provider, not a virtual provider, but a remote telehealth provider. Utilize your nursing staff or ancillary staff if you've got to. I'm biased towards nurses, but utilize your in-person nursing staff to engage with the patient, explain to the patient, hey, you're going to see a specialist because we don't have them here physically today. Normally we would just call them and the doctor would talk, but I want you, the patient, or you, the parents, to get to talk to the specialist. So I'm going to put you on camera. You're going to have an engaged interaction with the specialist, and you're going to get your questions answered. This specialist, maybe behavioral health specialist, maybe the cardiologist, maybe whatever it might be, is going to engage with you and then also meet and talk and engage with your care team, your nurse, and your ER doctor that's here. And we're going to have that continuity of care. Just by that simple explanation, and it doesn't have to take forever, but by having that explanation with the patient and ensuring they understand the process ahead of the process actually happening, that's what helps build the trust for patients. And by and large, especially because we're all getting more comfortable with technology and Zoom calls and iPhone calls, the trust gets a little bit more comfortable there. It's just we've got to explain to our patients what's going on. And then as far as the specific to pediatrics, obviously explaining to the parents. And then I think parents get this added benefit of knowing that these resources are there, and as they get more comfortable with them in the acute care space in the hospital when they're actually there, the trust is built that, hey, I can call my doctor when I'm at home as well. So I think that's a huge benefit to this next generation of children growing up in America, that we're going to be leaning on the technology more and more, so that some of those worried well parents that maybe just have a question about, my kid has a fever and I forget, what do I do? Is it Tylenol or ibuprofen or both or alternating? You can just utilize technology and call your healthcare provider. But in short, it starts with education and teaching. I do think there is huge value in having that exchange and that education early on. And then, having that warm handoff. The example that I keep kind of bringing up, which I will explain here in a minute, is ED triage, where a nurse triages the patient in person and then connects to a remote provider. But if that nurse can explain to the patient exactly what's happening and why and how it's better care, that's how we build trust with our patients and build trust in the technology. And then it's just the technology fades to the background. In a few years, I think already it's happening, but year by year, we no longer think of it as telehealth. It's just part of healthcare. We don't even say electronic charting anymore, right? It's just charting. This is the old adage. We don't say online banking anymore. It's just banking.